another misconception we often hear about is antibiotics, cure viral illnesses, but it does not help. It actually drives resistance against antibiotics, lessening our choices within the antimicrobial therapeutics that we have. And, antimicrobial resistance is a huge issue in healthcare. It almost costs our healthcare system in the US close to $5 billion annually.
Are there any new tools or tests or treatments that have really come into infectious diseases?
From a therapeutics perspective, AI is influencing us in a big way. It's helping drug modeling and new drug discovery, which is enabling us to combat antimicrobial resistance. There are centers that are delving into phage therapy. For our listeners, phage therapy is basically you use viruses
Yeah.
that get repurposed as bacteriophages that target and kill bacteria. And it's used again to treat antibiotic resistant infections. It's a precise treatment, that has minimal disruption to the body's natural microbiome.
Hey everyone, welcome back to FutureMed Connect, where I talk with healthcare professionals about their journeys, their work, and their advice for students who are thinking about going into medicine. Today, I'm really excited to be joined by Dr. Aalok Khole, an infectious disease specialist at Atrium Health here in Charlotte. Infectious disease is one of the most interesting and important fields in medicine, especially with everything happening in the world today. So I'm super grateful he took the time to talk with me. Let's jump right in. Dr. Alok, can you tell us a little bit about your background and what inspired you to go into medicine?
Sure. First of all, Atharva, thank you so much for having me on this podcast. I think this is a great initiative, and I hope your listener base increases every day, and that this is helpful. I wish you all the success for this. Starting off from a background perspective, I was born in Mumbai in India. That's where I was raised. That's where I did my med school. Um, you know, as you go through school, as you go through undergrad, there are certain subjects that attract you, and then some others that you don't really enjoy. But biology was something that caught my attention. It's not that I didn't enjoy maths, physics, chemistry, and the other allied sciences, but the interplay of physiological processes sort of intrigued me, and so I naturally gravitated towards medicine. That became a calling. I think there was also a role of just having grown up seeing my parents. Both of them are PhDs. So there was always a scientific sort of fervor and dialogue in the house, which always got me interested, and essentially transitioned into me getting into med school. As I went through my training back in India, you get exposed to different sort of subjects as you go through your second and third year. The first year is pretty much basics, um, and that's when I realized that I was more of someone who enjoys taking a step back, thinking about the physiology of a disease and how best can that be tackled. So that's sort of where I realized cerebral fields is where my calling lies, and that's how I got attracted to internal medicine, which is usually a subject that you pursue residency in before you specialize in one of the subspecialties, such as infectious disease, cardiology, gastroenterology, endocrinology, so on and so forth. So I came to the US, after having given my medical licensing examinations, pursued my residency. I was also a chief resident for a year before then pursuing a 2-year fellowship in infectious disease and immunology. All of my training was in Massachusetts before, working with Dartmouth for about 6 years as an ID doc, and then moved to Charlotte about 6 months ago. So it's a short way of describing a long,
Yeah,
15-year long journey.
right. Yeah, that's really interesting. Everyone's medical journey is really different
Yeah.
compared to the other people I've interviewed before. And what really pushed you to go into the infectious disease rather than, let's say, like another family medicine doctor?
Yeah, so while I was doing my internal medicine residency, you have all these sort of savvy, glamorous fields that you can do electives in, cardiology, gastroenterology, which are very procedurally driven and heavy. But it also takes a natural calling to sort of enjoy that sort of work. as I went through the routine, uh, there were a couple of specialties that I played with, and one was infectious disease and one was endocrinology. The reason these fields sort of attracted me was, if you think about it, these are fields that don't restrict you to a particular organ system, so to speak. Like, for example, if you decide to become a cardiologist, you're dealing with the cardiovascular system. So that's your heart and blood vessels. If you become a gastroenterologist, you're working with the intestines and the stomach and so on and so forth. But infectious disease is a field which sort of encompasses them all. Because you can have an infection in the brain, you can have an infection in the bloodstream, you can have an infection of your heart valves, of the liver, of your skin and soft tissue. It's also a field where I, sort of have the ability to cross boundaries and interact with surgical colleagues. So you can have joint infections, so you're dealing with orthopedics. You can have solid organ system infections, so you're dealing with surgeons. And that sort of interested me more to infectious disease as I got to learn more about it, because it doesn't restrict me. Every day there's something new to look forward to, something that's going to challenge your abilities to sort of deal with patients and help treating their illnesses and helping them get better. And so it keeps you guessing,
Yeah.
right? It doesn't let you get bored, and so that's sort of where I felt, all right, this is my calling. The other thing that attracted me is I also have a keen interest in leadership. I have served in some of these roles through chief residency and then in my first job. And I found a natural balance between infectious disease physicians and leadership skill sets, because the way you tackle administrative problems and the way you tackle medical issues in the world of ID is very similar. You got to do you have to be on a fact finding mission. You have to know all the points. You have to know the pros and cons before you come up with a solution. And that sort of allowed me to explore my leadership instincts as well. And it felt like a natural fit. So
Right.
that's sort of what attracted me,
Yeah, I mean, the scope is really larger than infectious disease. And
for sure.
yeah, for viewers might not be familiar, can you walk us through what an infectious disease doctor does on a typical day?
Yeah, that's a great question. It sort of depends upon what you decide to do within the realm of infectious disease. So, for example, in my current job, I'm 100% clinical, right? So my day begins in the hospital on most days. And then you can choose to sort of do outpatient clinics. So you can be in an office-based setting, which I do about half day a week. So, 4.5 days, I'm in a hospital setting, seeing patients, doing my consults, going about the routines, and then half a day is in the office for folks that don't need to be in a hospital yet, are suffering from some sort of an infectious disease, or basically follow-ups from when you've seen them in the hospital, and now you're ensuring that you're tying all the loose ends together and making sure they have a plan in place. Now, you can decide to be part clinical and partly involved in something else. So, for example, in my previous job, as I said, I had indulged in leadership and administrative roles. So you can serve in allied interest areas like infection prevention and control, where you are overseeing the approach to preventing healthcare associated infections in patients who come into the hospital setting, which is a huge issue.
Yeah.
And you have to try and make sure that doesn't happen, because people come to the hospital to get better, not to attract or have suffer from more infections than what they've already come in with.
Yeah.
You can choose to delve into antimicrobial stewardship, which is basically governing the appropriate use of antibiotics, so that you're not prescribing antibiotics willy-nilly, resulting in antimicrobial resistance, which is again a huge issue from a public health perspective. You can indulge in research, you can indulge in innovation. Several of my infectious disease colleagues went into industry and decided to be executives or leadership, within research organizations or even within pharmaceutical companies. I think public health is another field that folks can go into, which is you run the State Department of Public Health. You are basically involved in community medicine from an infectious disease perspective. And then the other sort of way you can shape your day is, well, if you take on some administrative roles within hospital leadership. I've known of ID docs who've served as chairs of medicine, who've served as chief medical officer for a hospital. So depends on your sort of interests, your skill set, and then you can tailor your day and your life as you need it to be.
Yeah, I mean that's a lot more, than most people probably realize. Infectious disease really touches every part of the
Yeah.
hospital. And infectious disease seems like a field that's always challenging. What was your training like, and what does it take to become a specialist in this?
Yeah, it's so as an ID doc, you're dealing with the routine stuff, and then you're dealing with emerging infections. So routine infections, like for example, for our listeners, any bacterial viral infections like cold, sore throat, wound infections, joint infections. You can have non-communicable illnesses, right? You can have bloodstream infections, you can have heart valve infections, you can have joint infections. So basically, you're dealing with any and every part of the human body. So the training is just as rigorous because you're not focused on one system,
Right.
right? I think the other key piece to this particular specialty is just given the all encompassing nature and the influences it can have not only on the patient, but also with respect to what the repercussions can be for the community, for public health in general.
Yeah.
It's a field which is heavily rooted in science and evidence, right? And when you say science and evidence, we all know that it's ever evolving. So you have to have the grit and the ability to sort of adapt to science and evidence as it evolves.
Yeah.
I think in today's times, as everyone knows, you have to have the ability to sort of be educated, be knowledgeable, but also be have the determination to stand by what is right. And you have to be very steadfast and very patient in one's approach to care. Reason being, a lot of the infectious diseases need nuanced and longitudinal care. It's not like a one and done. I have certain patients who I've been following, for months and years, because of the fact that some of their infections can be controlled but never completely cured. And
Right.
so, when it comes to that sort of a relationship with patients, there's a lot that goes into sort of analyzing and helping diagnose, but it's also a lesson in humanity because you really can't be an intelligent person to be a great doctor. You also have to be a very good human being.
Yeah.
And I think, I really see that of being of critical importance in a field like ID.
Yes, that's really helpful to hear, for especially students thinking about this path. And
Yeah.
now that we're on the topic of teens, I'm sure many kids my age, they have experienced COVID-19 and stuff like that. There's always, new viruses, outbreaks. What do you think are some of the biggest misconceptions, people have about infectious disease?
I think this is a very pertinent and a timely question.
Yeah.
And I would like to sort of take this opportunity to address some of the stuff that's been talked about in the media these days. I think the biggest issue is we are really troubled by the fact that science is politicized these days, right? And that has ripple effects on every strata of medicine, not infectious disease specifically, but more so in this realm because of, again, the connections with public health and community health. For example, during COVID, right, there was a misconception that well, rather than isolating and quarantining and vaccinating people, let's just have large scale gatherings to induce herd immunity, meaning infect each other, get each other immune, and that will help us, stem the curve, the tide of infection. But that didn't really work. I think what it led to was unnecessary loss of lives at critical times. I think we are seeing similar repercussions of beliefs, with respect to uh, measles and whooping cough outbreaks in the US and Canada, and in countries where these diseases were, near extinct or almost close to eradication. But what has happened now is, this there's disbelief and misinformation, which really needs to be curtailed. I think vaccines have made several infectious diseases preventable, and people need to rely on them for that because these are the tools we have, and if we don't use them, it's really not worth all the effort that has gone into designing these these studies and all these, interventions. I'm
Right.
not saying have blind faith, right? Our listener population is in a phase where you're trying to absorb all the knowledge that's coming at you like a sponge, and absolutely question the evidence. Trust but confirm,
Yeah.
trust but verify, but don't oppose it just for the sake of it, right? I think another misconception we often hear about is antibiotics, cure viral illnesses, but it does not help. It actually drives resistance against antibiotics, lessening our choices within the antimicrobial therapeutics that we have. And, antimicrobial resistance is a huge issue in healthcare. It almost costs our healthcare system in the US close to $5 billion annually. And it's really being tackled at a federal level, but we need to keep up with those efforts. And I think it boils down to awareness within younger population, as well as their parents, to sort of help us help them.
Yeah, I mean that really makes a lot of sense, with obviously online news is being spread constantly over there.
Yeah.
And again about COVID-19, I'm sure once that started, your office must have been packed with many patients coming in and out. Are there any, learning experiences that you took from that? And did COVID-19 change the way that you worked with infectious diseases?
Yeah, I think COVID-19, how much ever we want to forget those times, it's hard to do that. But I always like to look at the positives that we got from the disease and the pandemic in itself, because we've talked a lot about the negatives. I think it had a huge impact. It shone a significant light on the field of ID, which was I often undervalued, and I don't say undervalued. It's a respected field, but it's not as glamorous, right, as some of the other specialties. We don't do procedures day in and day out. We don't go in at 3 a.m. in the middle of the night and save a life, but we save lives, albeit silently, right? So I think COVID-19 drove a lot of interest in the field, but unfortunately, when we look back, a lot of it was also temporary, because it also resulted in a limited workforce getting overworked, and it led to burnout. So we had a lot of colleagues who actually moved away from the field, which was unfortunate.
Right.
I think personally, I served a rural community in New Hampshire for 6 years. I joined as an ID physician in the Dartmouth system. It was my first job out of training, and was hit with the pandemic within 9 months. So there was no learning curve. It was pretty much you learn on the job and run with it. And I think, what I learned is how to be a voice of reason that is rooted in science and not in misinformation. I learned what it is like to lead in such times where trials and tribulations were coming at us, multiple times a day. Guidelines were changing multiple times a day, and we had to adapt our messaging to not only help our patients but our staff and the community, because everyone was affected in a very, very similar fashion. But I think, I also saw the fruits of our labor as a specialty. There's no feeling like seeing lives saved directly and indirectly due to all our efforts. So that's the beauty of this field. You don't really have to be bedside to affect a person's life positively. You can do it through one of several different ways that we've talked about before.
Right. I mean, that's really powerful. It's so nice to hear this from a person who is actually in the middle of
Yeah.
all of this disease.
Yeah.
And now in the modern day and age, I mean, technology is just increasing rapidly, AI tools and stuff like that. Are there any new tools or tests or treatments that have really come into infectious diseases?
Yeah, absolutely. I think we are no strangers to evolving technology, and we love it in the world of ID because it's influenced it through various touch points. If I was to think about diagnostics, we've had significant technological advances by way of PCR tests and next gen sequencing. These are words people have heard during COVID-19, so I'm sure these are not alien terms that I'm mentioning, but it allows us to get an answer about a disease within hours, which influences treatment decisions sooner, which helps get the patients better. From a therapeutics perspective, AI is influencing us in a big way. It's helping drug modeling and new drug discovery, which is enabling us to combat antimicrobial resistance. There are centers that are delving into phage therapy. For our listeners, Phage therapy is basically you use viruses
Yeah.
that get repurposed as bacteriophages that target and kill bacteria. And it's used again to treat antibiotic resistant infections. It's a precise treatment, that has minimal disruption to the body's natural microbiome, which is crucial because you only want to target what's bad. You don't want to wipe out what's good. And that's it's really an evolving science, and we're all looking at it as to how can that be adapted into mainstream science and hopefully soon. From a public health perspective, technological advances are enabling, sort of allowing us to build predictive models to enhance our ability to diagnose clusters and outbreaks sooner so that we can sort of, stem the tide. There are prompts that we use within our health record systems which guide people and nudge people in the right direction to use antibiotics in a judicious way so that we can conserve them for when we really need them. So different ways in which technology has an interplay with the world of ID, and uh, also exciting.
Yeah. That's really great to hear. I mean, technology just keeps pushing medicine forward and forward. And for listeners of the videos, I'm sure there's many students listening about this. What kind of advice would you like to give them as they start exploring this path of medicine?
We are really excited to have bright minds and keen individuals to join us because everyone needs a physician at some point in their life, and we really need good physicians. And I'm partly biased because we also want good ID physicians. I
Yeah.
think the advice I would give is like what I give to anyone who comes to me asking, "Hey, I'm interested in the field. What do I need to do?" I think patience and perpetual interest, that's key, right? It's a unique field where someone's life depends on you. And so giving it your best is imperative. There is no other option. You can't have second thoughts, when you're in the middle of doing this, right? You have to be 100% committed to the field, and you have to do justice to the opportunity being presented. um, as I mentioned before, the opportunities are limitless, and one can choose their liking um, as to how they want to be influential within the field, be it medicine overall or infectious disease in specifically. But ID, I can talk about. It's not all specialties give you that freedom to branch out within the field, yet influence patient care. I think ID is uniquely positioned to allow you to do that. And I hope our conversation today has influenced at least a few young students out there, because you have to be passionate about your interests and you have to be perseverant to be successful. As long as you sort of do that, I think this path is all ready to welcome you.
Right. That's really great advice. I think a lot of students watching this will really appreciate hearing that from someone working in the field. And that's all the questions I've had today. Thank you so much, Dr. Khole, for taking the time to speak with me today. I really enjoyed learning about your specialty and hearing your insights because me personally, this is the first time I've actually met an infectious disease doctor. So it's really good to hear about your experiences. And to everyone watching, I hope this episode helped you understand what infectious disease medicine is really like. If you enjoyed it, please make sure to leave a like on the video. Thanks again for watching, and I'll see you in the next episode. Thank
Thank
you.
you.